Thank you, everyone. Fantastic presentations. Definitely difficult to follow. My name is Keith Davis, and I am the Healthy Communities Coordinator for the City of Philadelphia. In that role, I help to integrate the health department's goals for reducing chronic disease across the city and across neighborhoods through the city planning process. So I've kind of bounced from psychology to planning to health, back to planning, where I am now. My first foray into planning, I was very excited. I brought ANOVA's chi-square test to show, why they should be doing, this and that, and that was immediately tossed for just show us the data. Then I eventually went back into public health. I worked in San Francisco. Learned a lot about health impact assessments, came back to planning in Baltimore and then now in Philadelphia, and doing health impact assessments for the health department is vastly different from trying to consider the health impact of a given project in planning. So there's that push and pull that exists. And I think for that reason, it would be worthwhile for me just to talk for a few minutes about my perspective of planning and health and how they work together, and sort of like what my day-to-day is. And we talked about the past and the future. I just want to talk about the present for a second in Philadelphia. So just to give some context, a lot of you may already know, but I think it helps to reiterate. So land use planning is the process for guiding the orderly growth and development of the community. Planners can work at the state, the county, the regional, or the local city level. Whichever level they're in, they work each day to create or implement a comprehensive plan for their community. The comprehensive plan is a vision and roadmap for aligning multiple interests in that community towards a goal for sustainable growth and development. And city planning is unique in that, or at least in Philadelphia, it's unique in that we're given an advisory role in the capital budget process, as well as an advisory role in the zoning process. And these are the two primary tools that we use to advance the comprehensive plan and the vision. So I want to talk for a second about those. So the capital budget process is an annual request for funding from individual departments to the budgeting office to complete specific capital projects or brick and mortar projects, as opposed to like operational work. Examples of requests include streetscape improvements, runway extensions at the airport, new health centers, improvements to existing health centers, transit station improvements, things of that nature. Prioritizing these projects for consistency with the comprehensive plan is a goal of the planning department, and that's one of the tools that we use. City planning also has an advisory role in creating and maintaining the city's citywide zoning map. Properties have zoning designations that serve to limit their form, such as their height or their width, as well as their function, such as a residential property, commercial, industrial, institutional, open space, mixed. So a coordinated zoning effort can be an effective tool then for ensuring that residents have opportunities to choose different lifestyles, whether it's raising a family out in a suburban style neighborhood, or living a life where you can walk to work, walk to school, and have access to different city amenities. And also it's important for people who might not have those options to, at least at the minimum, have access to city amenities. Access to healthy foods, access to park and recreation, access to safe and convenient and diverse transportation networks are goals that are shared by both planning and health. However, the politics that are involved in a process of planning can sometimes overshadow the realization of those goals for certain at-risk populations or low-income neighborhoods. So my work then is to work in the planning process to help shed light on these vulnerable at-risk groups to make sure that they can share in the benefits of growth and sustainability. So Philadelphia is currently updating their comprehensive plan, Philadelphia 2035. It's a new vision for the city for the next 25 years. In order to implement Philadelphia 2035, they're going out into each of the city's 18 geographic districts to see what the strengths, weaknesses, opportunities, and threats are in those districts so that they can build a plan with recommendations for zoning changes, for capital improvements projects that can ensure that the economic and environmental benefits are felt by everyone. So that's sort of the equity piece and then the sustainability for the plan. My role then is to use the data from the health department, the community health assessment, to take that data and to build a profile for each district, sort of as the beginning of the planning process, and then to see that there are certain health disparities in each district, and then kind of build a hypothesis about why those health disparities might exist, and then join the rest of the planning department in our outreach to identify what might be causing those disparities, and then working with the planning department then to inform the plan to address those specific health disparities. And I'm getting to stop, so thank you.